Assalamualaikum dear doctors. In this video I am discussing about secondary glaucoma. So secondary glaucoma is the name that used to describe the glaucomas that occur as a side effects or secondary to another underlying medical conditions or trauma. This differs from the primary glaucoma where there's no identifiable causes for the glaucoma to develop. So we know that now the definition of the glaucoma is that group of disorders characterized by a progressive optic neuropathy resulting in characteristic appearance of optic disc and a specific pattern of irreversible visual field defects associated with raised intraocular pressure. Now about secondary glaucoma. That is a group of disorders in which the raised intraocular pressure is associated with a primary ocular or systemic disease. Steroid-induced glaucoma is a type of glaucoma that is associated with steroid use. Extended steroid use after the surgeries, especially topical steroids after eye surgeries, can lead to elevated intraocular pressure and glaucoma. Now, the acute versus chronic intraocular pressure elevations. In acute, that is, intraocular pressure normalizes within days of discontinuing the steroids. And chronic is that elevated intraocular pressure persists even after discontinuing steroids, and traditional glaucoma treatment is often employed. Risk factors of this steroid-induced glaucoma are primary open-angle glaucoma (POAG), type 1 diabetes, very young or very old age, and high myopia. Treatment include discontinuation of the steroids, eye drop, medications, laser, and surgery. Look the images we are seeing how glaucoma patient present. Now there is a question common in exam that 12 years old girl uncontrolled asthma inhaled steroids developed peripheral visual field defect. On examination, there was increased the intraocular pressure and diagnosed as secondary glaucoma. What is the initial management for this condition? So, this secondary glaucoma, the initial management is that prostaglandin analog, lanoprost. So, this is all about the steroid-induced glaucoma or secondary glaucoma. Please do subscribe and share MRCPC with Dr. Emma Choudhury. Thank you.